Hello everyone, this is Mr. Matus and I'm here to discuss with you the tuberculin skin test. So I'll be discussing the purpose of the test, how it is being administered, and also what are the parameters to be used when interpreting the result of the test. So let's go and discuss this topic. So tuberculin skin test is a test that is considered to be the standard method of determining whether a person is infected with Mycobacterium tuberculosis, which is your TB. So the other name of tuberculin skin test is the Matus tuberculin skin test, or TST. Now, it is very important to remember that the purpose of tuberculin skin test is to determine if the person has been infected with tubercle bacilli. So it doesn't really mean that the person has active tuberculosis or has an ongoing clinical condition, but only to find out if the person has been infected, or in the NCLEX, what you would like to look for in terms of the term that describes the purpose of this test is to find out also if the person has been exposed or has had contact with a person who has tuberculosis. So again, the three words that you want to look for in the NCLEX will be if the person has been infected, or if the person has been exposed, or if the person has had contact with someone who has tuberculosis. So the question is, how do we carry out this skin test, or how do we do the procedure? So the TST is performed by injecting 0.1 ml of tuberculin purified protein derivative into the inner surface of the forearm. So the important number that I would like you to remember is 0.1 ml, because that's usually being asked in the NCLEX, the amount of the PPD that must be placed into the syringe. Now, the injection should be made with a tuberculin syringe. So you're not using any other types of syringes, but the tuberculin syringe is the one that's being used. And remember that a tuberculin syringe is equivalent to 1 ml. Now, the TST is administered intradermally, and when placed correctly, the injection should produce a pale elevation of the skin. So we call that the wheal. So the wheal, which is 6 to 10 millimeters in diameter. So how do we read the TST? So reading the result of Matus skin test, it involves the time frame, which is between 48 and 72 hours after the administration. So this is another important number to remember, the 48 and 72 hours, which is almost 3 days. And a patient who does not return within 72 hours will need to be rescheduled for another skin test. So it's important to remind the patient that he goes home and he has to come back in 72 hours so that the result of the test can be read. So the reaction should be measured in millimeters of the induration. So what should be measured should be the induration, which is a palpable raised hardened area or swelling. Now in the NCLEX, remember that for the Matus skin test, we do not measure the erythema or the redness, but rather it's the induration. So the diameter of the indurated area should be measured across the forearm. And there are certain devices that we can use to measure the induration. So the source for this information is from the Centers for Disease Control and Prevention. So if you want to find out more information about tuberculin skin test, the website has a lot of information about this test. Now, a very important part of our discussion is to determine what are the parameters that you need to use when interpreting the results of tuberculin skin test. So there are three main parameters. So you have the first column, the second column, and the third column. And what we will be doing is just going over the groups of patients that you need to consider in terms of using the different parameters, which are the 5 or more parameters, 5 or more millimeters, 10 or more millimeters, and the 15 or more millimeters. And the importance of this is when you take the NCLEX, you want to make sure that you know what's the risk factor of the patient, what's the background or history, so that you use the right parameter when you are interpreting the result of the skin test. So for the first column, which is 5 or more millimeters is positive, this includes patients who are HIV infected, patients who have a recent contact of a person with TB disease, persons with fibrotic changes on chest radiograph or x-ray consistent with prior TB, patients with organ transplants, persons who are immunosuppressed, or those who are taking steroids, for example. So you will notice that we have a lower threshold for patients who have problems with immunity. So you will notice that in this column over here, 5 or more millimeters is already considered positive to a person with HIV. So that's really something very important for you to remember when you're taking the NCLEX, that you need to remember those patients also with organ transplants are also high risk for tuberculosis. So that's why 5 or more millimeters for them is already positive. For 10 or more millimeters is positive, these are the patients. So patients who are recent immigrants, which are less than 5 years from high prevalence countries like third world countries, injection drug users, residents and employees of high-risk congregate settings, mycobacteriology laboratory personnel, persons with clinical conditions that place them at high risk, children who are less than 4 years of age. So this is something that you want to make sure that when you're looking at the NCLEX question, if the child is around 2 years old, then you're using the 10 or more millimeters parameter. And lastly, the group will be infants, children, and adolescents exposed to adults in high-risk categories. Now, when do we use the parameter of 15 or more millimeters? So it's only being used for those patients with no known risk factors for tuberculosis. So if the patient is somebody that doesn't fall to the other two categories over here, then we are going to use 15 or more millimeters for those patients. So this is just a very good summary or illustration of the groups of patients and the risk factors that you need to consider when using which parameter for interpreting your Matus skin test. So take note of this in the NCLEX. So there you go, everyone. That was just a very quick review of the steps and the purpose of the Matus skin test. So just remember that the Matus skin test is just a test to determine if the patient has been exposed to tubercle bacilli. So more tests has to be done to find out if the patient is actually having an active or ongoing infection, such as your sputum culture or chest x-ray. And also remember that BCG is not a contraindication for carrying out the TB skin test, because BCG does not give the person lifelong immunity to tuberculosis, especially if the result of the skin test is less than 5 years after BCG vaccination. Usually when that happens, the person is probably really has been exposed to tuberculosis or tubercle bacilli. So remember that. So if you like this presentation, please click like or share or subscribe to my YouTube channel. And you could also visit my website at www.matusnursingreview.com. Thank you very much.